Good, Brian. Nice to see you. Hope all's well with you.
As can be expected.
Yeah, yeah.
Well, I have 1:15 straight up, so we will go ahead and get going. Welcome everybody to our bi-weekly briefing on the COVID pandemic with the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We'll open up with opening comments, and to start off with, those of you who may be monitoring the state's briefing that started at 1 o'clock on this, Dr. Christina Box, the state health commissioner, just noted that she said this is the darkest time in the pandemic. So with that as a scene setter, we'll start with Bloomington Mayor John Hamilton, and we get our local picture.
Thank you, Chuck, and thanks everybody. Indeed, these are alarming times, alarming signals going on. I'll quickly give my local city numbers. We actually have had 4 positive cases among our employees this week. We reported that yesterday. That's the highest 1 week total of positive cases for us since January 28th for 7 months. So while we're a small sample, that itself is of concern, of course. We do have 63% of our employees now have filed for a $100 wellness benefit. We're glad to see those numbers keep climbing. I'll report the weekly City of Bloomington utility numbers. You know, we're doing this wastewater sampling for the copies of the COVID gene in the wastewater of our system. Our South Side plant, Dillman Road, over the last 3 weeks has actually seen a significant decline in those numbers from 460 copies per 100 milliliters 3 weeks ago to 67 last week to below 10 to a non-detect limit this week. The North Side Blucher Pool plant, the relative numbers are 21, 12, and 38 this week, a little rise this week. So again, I want to caution this is kind of an experimental thing, but it is relevant at least to share that. It's also worth noting Monroe County, our county, is among the very lowest in the state in terms of cases per 100,000. That's a good thing. We're among just a handful of those who are in our level of number of cases per 100,000. But as Chuck, I didn't hear that briefing, but the state, the signals are extremely alarming. Our state in June, we had 200 or 300 cases per day in June. It is now 3,000 or 4,000 cases per day, and the last 3 days have been around 5,000 cases. Just to repeat that, in June, it was 200 or 300 cases a day reported in the state. It is now 3,000 or 4,000 running average, and the last 3 days, 5,000 cases. Hospitalizations have gone from below 400 statewide to now over 2,000. Deaths have also substantially increased. Locally, we're seeing similar numbers. I know you're going to hear some more specifics, but where we had 5 to 7 daily cases in June, we're now averaging 30. Hospitalizations, I know you'll hear more specifically, but going from in the state database in the teens to over 100 hospitalizations. People are getting very sick. These are alarming numbers. It is really upsetting, disturbing to have to share these, but that is what they are. We know vaccinations and masking are what we need. I hope and encourage the state will move forward. We know locally how important what our steps are as well. The masking order has been very important. Of course, we're reopening a testing site. I'm sure you'll hear more about that from the health department. More employers and institutions should and can be considering stronger protections and incentives for vaccinations. We are, as a city employer, I believe we're doing relatively better as a county, in part because of the protective measures that we have taken over this whole pandemic and have taken recently, and in part because institutions like Indiana University, like IU Health, like our school system are very proactively taking the steps to assure the safety of their community and therefore the wider community. Just for example, IU on the dashboard, I know, Kirk, you will probably share that, but over 90% vaccinations, the highest of all the campuses. That's really important and valuable to us. So we need to keep at it locally. I think we may talk about today, we are continuing our weekly coordinating meetings, and we may want to move to weekly briefings again, because things are moving quickly. The pressures are high, and I look forward to learning more details about exactly where we are. And I'll just reiterate how important the collaboration is. It has been and will be among those on this call and a wider circle as well, how important that is locally, how much we appreciate that from the city and all of our residents. So I'll hand it back to you, Chuck. Thank you.
Okay. I was going to save that detail for the end, that we will be back.
Oh, sorry.
Yeah, so really for no other reason than the fact that I don't have to use the word biweekly anymore, but we will start doing these next week for a weekly update. Let's go to the Monroe County Department of Health and Penny Caudill.
Good afternoon. I want to touch today on some of the recent notices as well as some of the statistics about where we are. So Pfizer did receive full FDA approval for their vaccine for 16 and over. Comirnaty, I believe is the way that we're pronouncing that. And if you have been waiting for full approval for the vaccine before you were vaccinated, now is the time. The Pfizer vaccine has full approval, and we anticipate that Moderna and Johnson & Johnson will probably follow close behind that. Several professional organizations have recommended vaccination for pregnant women. I know that early on there was a lot of concern for women who were pregnant. That list of organizations is longer than this, but includes the American Academy of OBGYNs, Nurse Midwives, and Hispanic Medical Association, among others. The research has shown that the risk to a woman in her pregnancy when unvaccinated far outweighs any risks with the vaccine. There is no evidence that the vaccine causes fertility problems, and there is no increased risk of miscarriage with the vaccine. There is a risk to unvaccinated pregnant women who get COVID-19. They are 3 times more likely to need ICU care, and the risk of preterm births increases. If you are pregnant, seeking pregnancy, or you're lactating and haven't been vaccinated, please talk with your provider now about doing that. The CDC's Advisory Committee on Immunization Practices has recommended that some immunocompromised people may be eligible for a 3rd dose of Pfizer or Moderna vaccine. There's a list of specific situations where that's called for. So if you think that you are in that list, please talk with your provider and get your questions answered about that. Booster doses are not yet approved, and so they are not available yet. This is expected for some of the vaccines later in September. So what's the difference between a 3rd dose that we just talked about for the immunocompromised and a booster? Essentially, the 3rd dose for the people who were have compromised immune systems is because they may not have developed adequate immunity to begin with. So this 3rd dose should give them that added protection and increase their immune response. The booster doses that people are talking about are intended for people who did finish their series of vaccine, whether it was 1 or 2 doses. They developed an immune response, but over time, that immune response has started to wane. And this booster dose, or this additional dose of vaccine, would then increase their protection again. So there is a difference. Booster doses are not yet approved, and we will be ready to address that when those are approved and we know exactly what that looks like. In terms of data, the mayor talked about this a little bit. Since August 2nd, we have had 6 additional people die in our county because of COVID-19. So that is more than 1 a week. And we don't want to have increased hospitalizations or increased deaths. So when you hear us talk about vaccination, that is the top line defense that we have against those hospitalizations and deaths. In terms of vaccination rates, we seem to be stuck just over that 58% fully vaccinated in our county. We do have one zip code that has a very high, it's around 70% vaccination rate. And I believe that is 47401 or 6, I think it is. I'm gonna look that up. We had 60 new cases reported today. So we know that there is virus that is being circulated right now. We are seeing a high level of community spread. And so it is crucial when we have cases over 100 per 100,000, that is considered high transmission. And that's when the CDC is saying that we need to wear masks, that they are crucial even for the vaccinated when we are in public places. There's a large divergence between the 0 to 19-year-old age group as well in Indiana. We're seeing it locally, and that is where the majority of our infections are occurring, although they are happening in every age group. Currently this week, our cases per 100,000 were at 128, which was a slight drop. But as I look at the numbers over the past few days, I expect next week to be much higher than that. With that rise in community spread, what are we doing? Well, we continue to do contact tracing, or schools continue to do contact tracing. We continue to do vaccine clinics. Miller Drive has the Moderna Mondays, and we'll be adding additional days for vaccine. Outreach clinics in our community, we are shown that some of the big clinics that we've done are becoming less effective. So we're focusing more on smaller, more targeted clinics. As I've mentioned before, our school clinics are starting up, and those are optional, but they are a way for parents to ensure that their children who are eligible for vaccine but have not yet been vaccinated may not only get COVID-19 vaccine, but they can also get the flu vaccine if they want to do that. The impact of vaccination: the unvaccinated are 5 times more likely to have infection than the unvaccinated. And this comes from a recent study in California. The unvaccinated have 29 times more COVID hospitalizations than those who are fully vaccinated. So we know with the increased circulation, we also have an increased demand for testing, and that is very high right now. There's people wanting to get back to school and they need a test. Maybe they need a test because they're symptomatic, they're a close contact, what have you. We are working to reopen the community site on Morton Street. We have some contracts yet to be signed off on and received, and supplies to be received before we can open the doors. So we will share those details as soon as we can, as soon as we know them. And when we have a date and a time for the opening, we will certainly push that out very, very quickly. With the high demand and not having the test site open yet, we did request a mobile unit from the state, and they are actually here today and tomorrow. They are at 500 North Profile Parkway today and tomorrow from noon until 8 p.m. They will be doing both testing and vaccination. It is a drive-through clinic, and while appointments are encouraged and make things go more quickly, they are not required. And I will tell you that for the testing side of things, if you went to try to schedule an appointment, there's a big glitch with it on the Zotex system. So don't let that stop you if you need a test and couldn't get that appointment. Go ahead and go. By appointment, again, if you could make that. Testing, they will be doing both PCR and the Binax Now rapid antigen testing, and vaccine, they will have Pfizer and Johnson & Johnson available. I also want to give a big thank you to the Indiana Department of Health and Cook Group for responding to our request and making that clinic happen today and tomorrow. And I will be happy to take questions shortly.
Okay, we'll check in with the Monroe County Commissioners, and I think Lee Jones is here for that today.
Yes, I am. Hi, everyone. I just would like to remind everyone once again that any residents of Monroe County who are having trouble paying for their necessities should apply to their township trustee, who it's their function to help people with situations like that. If you can't pay your rent, or if you aren't able to buy food or pay for your medications, please go ahead and contact your trustee and they'll help you out with it if they're able to at all. And every county resident does have a trustee. And if you aren't sure who yours is, you can check on the Monroe County website, which is co.monroe.in.us. And on the emergency management page, you'll find a list of trustees and what areas they cover. And I would like to thank the County Council for having worked with us to get a considerable amount of extra money to the trustees so that they are able to help people out and are certainly looking to do that. So please keep telling people about that, and hopefully we'll help as many people as we can. Thank you.
All right, let's next check in with IU Health and Brian Shockney.
Good afternoon, everyone. Thank you for joining us again today. Our numbers of COVID-19 inpatients across the IU Health South Central region during the past week continue to rise to numbers that we have not experienced since early in January during the winter surge. The numbers in Monroe County between IU Health Bloomington and Monroe Hospital show the same concerning trend. And there's also here a helpful graphic to demonstrate the power of the vaccine. IU Health continues to provide transparency in our data as we have throughout the pandemic. And as you can see, the majority of our COVID inpatients are unvaccinated. Even those who are vaccinated and have breakthrough cases do not experience the severe symptoms and haven't needed a high level of care, such as ICU care or ventilation care, as those who are unvaccinated. So the rule of 7 in marketing is you need to hear things 7 times to get them, to understand them. So I'm going to reinforce some things that have already been said. Over the past few weeks, as the number of COVID-19 cases has increased, our emergency departments and clinics across the community have seen an overwhelming number of individuals seeking care. In an effort to better support the healthcare needs of our community, we want to ensure individuals seek the right level of care, and we have expanded our walk-in clinics across the region to include evening and weekend coverage. You can see the locations and additional hours there on the screen that you can go to seek care. When these offices can treat primary care related conditions, non-emergency conditions, when you can't see your primary care provider. So no appointment is necessary, and COVID testing is available for those with COVID-19 symptoms. Although kids are much less likely than adults to get seriously ill from COVID-19, pediatricians are reporting a worrying trend. More children are being hospitalized with the coronavirus than any point during this pandemic. While school-age children, and that would be those between the ages of 5 and 17-year-olds, they only account for about 7% of the positive cases in Monroe County. It is 10.9% of the cases in Indiana and 8.2% nationally. So we continue to see an increase in pediatric cases in recent weeks, and easy access to testing for children is important to ensure the students are safer and safe as possible so they can benefit from in-person learning. So we're proud to continue to partner with the school corporations and our health departments to support pediatric testing and care. We have a drive-through pediatric testing site at our IU Health Miller Drive, out on Miller Drive here in Bloomington, the community health location for IU Health, and they support COVID-19 testing orders from our pediatric offices. So this is helping to get access to testing quickly and results for parents and school administrators. So established patients or their parents, they need to call their IU Health pediatric office and speak to a provider and be triaged for that testing. I'd like to talk a minute about pregnant women. Early in the pandemic, it was our wisest generation most impacted by the virus. During the second wave, as we had vaccines, we experienced younger populations getting COVID, and they required hospitalizations. And we also experienced deaths among this 30 to 50-year-old population. As we are in this surge, we are experiencing an increase not only in pediatric patients across the country, and here in the state and locally, but a rise in serious illness in pregnant individuals. The communication and information regarding pediatrics and pregnant individuals has continued to improve as we continue to learn more about the virus and its effects on all the age groups of people with various conditions. As Penny stated, the American College of Obstetricians and Gynecologists and the American Academy of Pediatrics recently stated pregnant and recently pregnant individuals are at increased risk of severe illness, including illness requiring hospitalization and illness resulting in death. If they get the COVID-19 virus, so please get vaccinated. The CDC has also stated, and I'm quoting, additionally, pregnant people with COVID-19 are at increased risk of preterm birth and might be at increased risk of other adverse pregnancy outcomes. Across the United States, 109,773 expectant mothers have contracted COVID-19, and 18,639 of those mothers, or 17%, have become hospitalized due to the severity of the illness related to COVID-19 and were all unvaccinated. With cases rising as a result of the Delta variant, the best way for pregnant individuals to protect themselves is to be vaccinated. I'm happy to take questions at the end.
All right, thanks, Brian. Let's next check in with Indiana University and Kirk White.
Hey, good afternoon. Let me start as I normally do with the numbers. And this past week, as the campuses start to come alive, Indiana University has recorded 68 cases, that 56 of those being student cases and 12 faculty staff positive for COVID-19. Our vaccination rate has increased almost a percentage point from the week before. We're now at 91.5% average with a student population percentage of 91.4% and student faculty and staff at 92.2. So we've seen some improvements in that in the vaccination rate over the past week. This compares with our overall campus rate of 87.4% across all of our campuses across the state. We are seeing an uptick in symptomatic cases, I should say symptomatic patients coming to the Student Health Center in Bloomington. So I believe what we're seeing is students may be experiencing things like normal fall allergies or head colds and things like that, but they're doing the right thing and they're coming to the health center to get what they consider to be a symptomatic check because they have some kind of symptoms. And that's a good thing. And our health center is seeing an uptick in students that are presenting themselves with those kinds of symptoms. And of course, we do the tests. And so far, we have a relatively low positive rate for a lot of those symptomatic tests, but we're keeping a close eye on it. And then let me just conclude with a study that was released this past week from Indiana University researchers and the RAND Corporation. And it shows that in the first 5 months of the vaccination effort, so that's really late December through May, that 140,000 deaths were prevented across our country because of the vaccination efforts. And that's a big number. To think that we have 140,000 more Americans that avoided this pandemic death because they made the choice to get a vaccine. And of course, that doesn't account for all the people who had much lesser cases because they got the vaccine. So some really good research done here. I put a link the study in the chat. And I think we'll continue our efforts to promote the vaccine. And of course, our testing efforts are ongoing and have gotten off to another good start this semester this past week. So with that, I'll conclude and be ready for any questions. Thank you.
Okay, and we also put a link to the IU dashboard. My colleague Amanda Roach just posted that as well. That's on our COVID site at covid.iu.edu. Those dashboard results, by the way, updating on Fridays now, if you are looking for those. The first questions here, first of all, from Ethan Burks, WFIU, WTIU for Penny Caudill. Neighboring Brown and Lawrence counties have seen spikes in COVID cases over the last week. How concerned should Monroe County residents be of this, and would you recommend any travel restrictions to these areas?
Thanks for that question, Ethan. Certainly we are concerned, and we're seeing spikes in cases here as well. We know that in terms of travel, I would just say all you have to do is look across this country and see that there is community spread everywhere. So we have to be diligent about what we are doing at all times. And so if you are unvaccinated, your risk is extremely high. If you are vaccinated, your risk is not very high, but there's still precautions that you need to take. Every day there's travel between the counties that you mentioned, people coming and going to work. We have people who live in this county that work in those counties, and vice versa. So I would just say that what we need isn't necessarily travel restrictions among our counties, but we need everybody to take care of using the precautions that we know we have. We refer to it as kind of the tools in the toolbox. Use the tools that we have because they work.
Next question from Ethan for Brian Shockney. Can you confirm that IU Health's vaccine requirement deadline is still September 1st? And what kind of internal pushback has there been from employees leading up to that deadline? And has IU Health seen a decline in nurses or other healthcare workers because they disagree with the mandate?
Yeah, so thank you, Ethan, and thank you for being here every week. Yes, September 1st is the deadline. So answer to your first question is yes. What kind of internal pushback? Not much. Our teams have been on the front lines and they see this every day. And they see the effects it has on patients in this community and their loved ones. And so very, very little pushback from our team members and our physicians. I'll say our physicians and providers, advanced providers, have had the highest rates of vaccine, almost 100%. And then to your question about decline in nurses, we have a very few team members who are leaving or have chose to leave and not get the vaccine. And last numbers I saw, it was 1% or less than 1% of our total 5,000 team members that we didn't have a documented shot on a vaccine on. So, and of those, many of those just haven't attested, haven't submitted their attesting. So very little effect on our operations. What's having the biggest impact is non-vaccinated patients who are overwhelming our system.
Next question from Dave Askins, the B Square Beacon for Penny. Monroe County's positivity rate has decreased to under 5%, but the positive case numbers keep climbing. Is there an explanation for that?
Well, certainly with the high demand for testing, we are seeing more testing being done. Some of that is IU's testing. Some of it is just community testing. Right now, as I mentioned earlier, there's high demand, so we're seeing a lot of testing. And as Kirk talked about, not all of it, even with the symptomatic, not all of it is COVID. And so we may see that positivity rate decline a little bit because of the high level of testing that's being done. Not all of it related to IU. Some of it just because people are going in because they are very concerned. So that will drop it. But what I'm most concerned about right now is the cases per 100,000 and how much community spread that we have. we've also talked about this. There is not one single metric or piece of information that we can use. We've got to look at the whole picture. So it's not just about positivity rate or the number of cases, but it's what's going on in our hospitals, what's going on everywhere. And that's what we try to look at.
Okay. Next question here for anyone. This also from Dave. Does the full approval of Pfizer's vaccine by the FDA remove barriers to local governments as employers to requiring proof of vaccination, or does the state law against vaccine passports negate that potential?
I'm not an attorney, but to my knowledge, it does not change anything at this point. Certainly, I believe that one of the underlying reasons or explanations for that had to do with the emergency use authorization. So perhaps it could change down the road, but I do not believe it will change anything for us in terms of requirements.
Yeah, I would just add, I have complimented our state government at times when they allowed local governments, which they do, for example, to put a mask requirement in place when we feel our local conditions advise it. We appreciate that flexibility. This is a counterexample to that, where the state government, in my view, has very ill-advised step to not allow local governments to take steps for our own employees' safety, to protect them as we would like to. I agree. I'm an attorney, but I'm a lapsed attorney, so I can't give advice either. But I don't think this changes the impact of that unfortunate state law. We will continue to look at ways we can incentivize and encourage the greater safety that comes from more and more vaccination, which some of our partner organizations right here on the call have demonstrated very, very vividly.
So another question from Dave, this also for anybody. Some entertainment venues and other places, and he mentions the Arc in Ann Arbor, Michigan, for example, are requiring attendees to present proof of vaccination. No vaccine, no music for you. Does anyone know of Bloomington or Monroe County venues that are requiring proof of vaccination?
I can weigh in. I am aware that the Buskirk-Chumley Theater, many of you know that, I'm sure, is requiring vaccination demonstration for some performances there. I'm aware of some other local venues that are doing that. I don't think I will name them directly right here, but there are those considering that, doing that locally. I do encourage folks to do that. I'll just say, look, it's kind of shocking that we're in this place with these vaccines, and yet we find ourselves with the kind of data that we see. If nothing else, think about the thousands of first to seventh graders trying to go to school who are happy to wear masks, who will wear the mask to protect themselves. They're doing what they're told. They're doing what they can. And yet the fact that too many of us are not doing what we can is putting them at risk, not just their education, but even their health, as we heard. And so I do think all of us doing what we can as individuals, as institutions, as venues, to try to recognize that this is really serious and the impacts are manifold and dangerous, the more the better from my perspective.
Penny, any that you know of at this point?
No, we've heard, I've seen things. I don't have any official word. So I too won't try to name places that I don't have that certainty about. But I do know that places are considering it. And, we've had people talk to us about it. So I think that we will see more of it.
Okay. And just for everybody here on the call, I have posted a link to the graphic that Brian showed about total COVID hospitalizations in the IU Health South Central region. That is an open Google Drive link that I've posted up if you wanted to get that graphic. Question from Patrick McGurr from the HT4, Brian. In light of the IU Health announcement that they are delaying about half of scheduled elective procedures, how close is Bloomington Hospital to full capacity, and how long of a wait is there for non-elective surgery? And he also asks, is it possible to get a bed and dedicated room still, or are makeshift rooms being used alongside other solutions like putting people in hallways?
Thank you, Patrick, for the question. We haven't had a question from you so for a while, so I appreciate the question to IU Health. In light of the announcement, we just began dialing back our surgery so we could make room for beds for patients. So as far as a delay, we don't have those numbers right now because we just started doing that. So I would, if I could give it to you, I would, but we just started moving in that direction. As far as beds, that's the reason, one of the reasons we did it, is it allows us now to have those freed up beds that normally surgical patients would have cared for, as well as those rooms that are in our surgical areas to care for our sicker patients. And most importantly, those staff now to care for those patients who we need to care for. So unfortunately, it's a shift away from those who need care. Remember, elective surgery does not mean we don't need it. It means that we have to triage who gets it first. And so these are our patients that we're putting off are patients who need surgery, but because of the COVID pandemic and because of their sickness, we have to postpone their surgeries in order to care for those who are sickest. So we are not putting patients in hallways. We are using now in our emergency department, sometimes in the waiting room and hallways until we can get them through. But that's that's a normal practice in America emergency departments right now, unfortunately. But no inpatients or anyone with COVID-19 or an inpatient in a hallway. They all have beds, and that's because we have dialed back our outpatient and inpatient procedures and shifted those rooms and staff to caring for our sickest patients.
I just want to be a broken record, but just reminding people that this is another kind of innocent victim of the fact that we can't get a control on this, because now there are a whole bunch of people who just want regular and need regular medical procedures who are it's kind of hard to measure exactly, but these are real costs of people who are, to no fault of their own, they're having to have medical access delayed because of the health system doing what you ought to do, which is protecting it. And it's just really frustrating to see that we we can avoid this. So I hope more and more people, now that it's fully authorized and we see that this we're still at this, that people can and thank the media for being here, but reminding people that this isn't just a debate that has kind of interesting policy questions about it. They're very real human consequences to our lack of ability as a community, as a country, as a state to move forward in the right way, that we can end this thing.
And following up quickly on the previous question about venues that may be asking for proof of vaccination, Mike McAfee from Visit Bloomington notes that the back door, the blockhouse, and the orbit room are all requiring proof of vaccination. So there are a few. Next question related to the other one for Penny Caudill, again from Patrick. Which measures will you take when beds fill up in Monroe County or parts of it? Are more restrictions possible?
Thanks for that question. And it's a very difficult one to answer. I don't have specific measures. Everything has to be kind of considered and not just based on the beds that are available in the hospital, but what else is happening around that. So one of the benefits of this group is that we meet and talk and stay in open communication so that we can look at what's happening in our community, not just those daily numbers, but what's happening in our sort of areas of the world, if you would, and then discuss how can we address those. One thing that is different this year right now than last year at this time is vaccinations. And that does change things a little bit. So we don't necessarily need more restrictions if people will get vaccinated and use the tools that they have.
Okay. Next question for Kirk White, also related. If Bloomington Hospital fills up, how does IU adapt? Can in-person classes continue?
Well, that's a good question, but I would echo what Brian and Penny said a few moments ago. We do monitor the overall health of the community jointly. All of us that are on this call today do that almost a daily basis. And I feel pretty comfortable that if we were to have additional needs for capacity, that there are ways for us to expand that capacity of our local healthcare system on an emergency basis, just as we have emergency management plans in place for other kinds of emergencies or disasters. We do in this case as well. And so we'll keep an eye on that. And of course, we've been experienced this past year in deciding the best ways to mitigate additional spread and that sort of thing. Indiana University does not want to go back to an environment like we had last year, where most of our classes were online to mitigate exposure. With a high vaccination rate that we have, we believe that we'll have less, even though we will have cases, we'll have less serious illness, so that you can get over it by taking care of yourself and perhaps being ill for a few days, isolating during that time. And that's going to allow us to continue along. And that's the planning factor that we have in place right now. We believe that we will not require from the university community this large amount of tertiary care type facilities and hospitalizations, because we have the high vaccination rate, which then leads us to less serious illness. And people are experiencing that. President Whitten did, as you all know, contract with COVID this past summer, but was ill for a few days. She isolated as she was required to for the full time, and came along with it okay. It's because she was fully vaccinated, and we believe that that's the path we want to head here. But of course, we have contingency plans in place if need be.
Okay.
I'd like to respond as well. We don't realize how important and the gym we have here in Indiana University and the leadership at Indiana University that has protected the healthcare system. It's not the case across the nation, and they have cared for their own. They have ensured vaccine, and when they have sick individuals and students, they have isolated them and provided care for them. And that is not the usual case. And so the least of our worries are the Indiana University Bloomington students and faculty. Our biggest worries are community citizens who are not vaccinated.
As we have been saying, we feel like the Indiana University campuses are among the safer places to be in the state of Indiana, and that's been true throughout the pandemic, and we think will be even more true in the days to come. I don't have any other questions here, and we're right up against time. Mayor Hamilton spoiled my surprise at the beginning by noting that we're going to start doing this weekly again, but we do feel like seriously that this is very important as we are in the middle of this Delta variant surge to go ahead and come back with these frequent updates. And we appreciate again the media for coming every week to ask these questions, because it is important to get this information out there. So with that, we will be back again next week at 1:15, and we will have a full briefing again on the COVID situation here locally. Have a good day, everybody.
Thank you, Chuck, for your work.
A lot, Chuck. I should know better than to go against the guy who runs the microphone. That was a mistake. That's always ill-advised. Thank
Can't
you,
wrest
Chuck.
control